Welcome to the online demonstration of CT colonography. Colorectal cancer can be found early when it is easy to cure. Treatments have improved. As a result, there are around 1 million survivors of colorectal cancer in the United States, and the death rate from colorectal cancer has been going down for the past 15 years. Thanks to colorectal cancer screening, polyps can be found and removed before they turn into cancer. The American Cancer Society estimates that there will be over 110,000 new cases of colon cancer and around 41,000 new cases of rectal cancer in 2007 in the United States. Combined, they will cause about 52,000 deaths. Who should have colorectal screening? The American Cancer Society recommends, beginning at age 50, both men and women should have a colorectal screening exam every 10 years. People with risk factors such as family history should begin screening earlier or have screening more often. Talk to your doctor about your own risk and when you should start having colorectal screening tests. Who should consider a CT colonography instead of a traditional colonoscopy? Anyone over the age of 50 with no known gastroenterology conditions. Anyone over the age of 40 with a family history of colon cancer or beginning 10 years prior to diagnosis of first-degree relatives such as father, mother, brother, or sister. Patients who have a history of incomplete colonoscopy, are allergic to IV sedation, or are hesitant to get screened because they perceive a colonoscopy as invasive, risky, time-consuming, or inconvenient. What is CT colonography? CT colonography is an FDA-approved non-invasive procedure which screens for polyps of the large intestine and colorectal cancer. Using standard CT images manipulated by software into 3D images, a radiologist can virtually see inside the colon. What is a polyp? A polyp is an abnormal growth found on the inner lining of the colon or rectum. Some polyps are known to be the precursor of colorectal cancer. Polyps can be benign, non-cancerous, or precancerous. If caught early, precancerous polyps can be removed before they become a true cancer. Research shows there is a correlation between the type of polyp and polyp size. Small polyps, less than 6 millimeters, are usually benign, with less than 1% chance of becoming cancerous. Larger polyps, over 8 millimeters, have a greater potential for being cancerous, the risk increasing in proportion to size. CT colonography can be as effective as standard colonoscopy, with additional advantages. Utilizing very complex software, CT colonography can view the colon from the beginning to the end, and in reverse. It can see behind folds and sharp turns. Unlike colonoscopy, which utilizes a camera on the end of a long scope, CT colonography can view the entire colon, regardless of redundancy of the colon anatomy or the presence of common outpouchings from the colon wall known as multiple diverticula. Traditional colonoscopy requires sedation and a recovery period. CT colonography patients do not need sedation and do not need to schedule a driver. CT colonography nearly eliminates the risks associated with colonoscopy, which include colonic perforation, bleeding, and adverse reactions to sedation. Approximately 1 in 1,500 patients who undergo colonoscopy suffer colon injury. These risks are significantly reduced with CT colonography. An additional benefit of CT is the ability to screen the anatomy outside your colon using the CT images. The radiologist will review the entire abdominal CT scan. Abnormalities and questionable findings will be reported to your physician. CT colonography takes about 15 minutes, while colonoscopy requires 2 to 4 hours, including the required sedation recovery time. One downside of CT colonography is the inability to remove polyps at the time of the scan. Some patients with large polyps will need to undergo a traditional colonoscopy to have large polyps surgically removed. It is important to note, however, that nearly 85% of patients that are screened do not have any significant polyps requiring surgery. How is the CT colonography procedure performed? Patients are required to follow a 2-day prep process to clean the colon. Detailed instructions outlining diet requirements and medication are given at the time of scheduling. Once at our center, you will be asked to change into a gown. Next, you will be instructed to lie on your side on the CT table. A trained technician will place a short, flexible, lubricated tube into your rectum. Through this tube, a CT technologist or radiologist will fill and distend the colon with carbon dioxide gas. A low-pressure pump is used to inflate the colon to constant low pressure. Every patient will receive different amounts of air depending on how large the colon is. Since the procedure uses a non-invasive technique, most patients do not feel any severe pain. Most patients describe the discomfort as feeling bloated. This feeling usually ends as soon as the procedure is finished. During the exam, you will need to hold your breath for several seconds. The images are taken while you're lying on your back and again while lying on your stomach. The exam, from start to finish, should take no longer than 15 minutes. You can return to your regular diet and normal everyday activity. There is no recovery period. Shortly after you leave our center, a radiologist will interpret the images of your colon and provide your referring physician with your exam results. CT colonography for colorectal screening is performed at Valley Diagnostic Imaging Services, Olympic Building. The center is located on the Valley Medical Center campus in Renton. If you are interested in scheduling your exam or have additional questions, please call our outpatient center, Valley Diagnostic Imaging Services, Olympic Building, at 425-656-5550. Our team of customer service representatives are ready to assist you.